Hello, everyone. Our topic for today is something fascinating. It is the pulmonary embolism. So, if I present to you with severe chest pain with history of immobilization, I have high risk factors for malignancy if there is immobilization, recent surgery, or I take oral contraceptive pills, whatever reason. Or okay, so what do you think of? It's
Immediately,
okay.
pulmonary
Yeah,
embolism.
it's most likely pulmonary embolism, and there are other differentials like pneumonia, pericarditis, myocardial infarction. These are other differentials. But our topic today is for pulmonary embolism. Okay, so there is pulmonary embolism rule out criteria. Okay,
Hmm.
this is for every patient with a shortness of breath, chest pain, okay, at low risk outpatient setting. Okay, so what are these ruling out criteria? Do you know?
Yeah, if the patient is young, if the patient is having like low respiratory rate, low heart rate, actually his saturation is high, and he doesn't have any sign of symptom of DVT, no history of immobilization, no history of estrogen use, and no swelling of his legs, or no history of
Perfect.
surgery.
Perfect.
Mhm.
If the age less than 50, if the heart
Mhm.
rate less than 100,
100,
if the
yeah.
oxygen above 95, if there's no hemoptysis or estrogen use or history of DVT, and there's no unilateral leg swelling or no surgery or trauma within the past 4 weeks. These are the criteria to rule out deep vein thrombosis. So what are the criteria that rule in deep vein thrombosis?
Uh, Actually, if there is any history of a previous DVT, if there is any history of or risk factor of hypercoagulable state, like underlying malignancy, use of oral contraceptive pills, and or recent surgery. Another thing, if there is any calf swelling,
Yeah,
yeah, any
excellent. Yeah,
superficial vein, varicose vein, any history of immobilization, or let's say if the sign is symptom mainly showing a DVT.
excellent. So three things. Number one, risk factor. For example, malignancy, immobilization, surgery, oral contraceptive pills. Okay. The second one is the alternative diagnosis, like pneumonia, pericarditis, heart attack, less likely. Okay, so this is one thing suggested by chest X-ray, ABG, EKG, D-dimer, suggesting alternative diagnoses are less likely. The third one is the signs of DVT. Okay, so after you see that, you do confirmatory testing. Okay,
Mhm.
okay. So what do you do
Mhm.
after that? After you find these symptoms of DVT?
Okay, you check like how the probability is going on. So if the patient, let's say, has low probability, we go for D-dimer. If the patient has high probability, we go for CT angio or ventilation perfusion mismatch. Ventilation.
Perfect, perfect. We depend on the probability of the PE. Unlikely, we go D dimer, and then we do CT and VQ only if the D dimer above 500. CT if there is no renal failure, and VQ if there is a renal failure. VQ mismatch. If the PE, sorry, likely, then we go to CT angio immediately or VQ if there is a renal failure. Okay, so spiral CT pulmonary angiography or VQ provide definite diagnosis, is very high specificity. After that, you confirmed it. What do you do?
We start anticoagulation
Okay, so
immediately.
if you have high probability with positive CT, you go anticoagulate. How about if you have negative CT and low probability? What do you do?
Negative CT,
Hmm.
negative CT, and low probability. Um,
You stop
Actually,
the
there.
heparin because you know the
Yeah.
heparin you started based on the clinical high probability. You don't wait for the CT. You just start it immediately. But if
Yes.
the CT
Yes.
come back negative, then you stop. How
Yeah.
about
You
if the
stop.
CT is inconclusive?
If the CT is inconclusive, okay. In this way, I think we do something else. We do DV, we do ultrasound or yeah, Doppler for the lower limb, something like that. I don't remember exactly.
Exactly. Yeah, you do pulmonary and serial lower extremity Doppler and the
Mm-hmm.
presence of DVT or positive pulmonary angiogram. So we do pulmonary angiogram or lower extremity Doppler.
Doppler.
Okay, so this is what we do. So pulmonary angiogram is the gold standard, but only
Mm-hmm.
used if the spiral CT or VQ are inconclusive. Okay,
Mm-hmm.
so this is very important because that's what step three is all about. It's about prognosis and timing. Okay, when do we do this thing? Okay, this is very important. Okay, it's complex management. It's interesting. So let's take a case.
Mm-hmm.
And just before we go to the case, let me uh, just lay some stuff out there. If the patient is stable, how do we manage him? Pulmonary embolism stable.
Stable, you go immediately with the heparin.
Yeah, low molecular weight heparin. What if he's unstable?
What do you mean, like unstable? So you mean
Hemodynamic instability, or if there is a renal failure, or if there's increased bleeding risk, or if you anticipate thrombolytic therapy, what do you do?
okay. In this case, I believe you check also for if there's contraindication of anticoagulant, and if yes, there's contraindication, you're gonna put a filter. And if there is no contraindication, I'm gonna check the kidney function. So if he has good kidney function, I'm gonna give him low molecular weight. If bad kidney function, I'm gonna give him IV unfractionated.
Okay. Yeah, exactly. In renal failure, IV and fractionated. Thrombolytics or cath
Yeah,
embolectomy, we can use that too. Okay. And bed rest, we
yeah,
did.
embolectomy. Yeah, right. Yeah.
Okay. So you
Mm.
start the timing, you start empirically with heparin bending result. This is the timing important. I will score you on that. Okay. So you can't advance the clock without that. If you do, you lose a lot of points. You add warfarin within 24 hours. These are the two important timing points.
Mm-hmm.
Okay. So let's do a rundown on a case and let's see what we
Mm-hmm.
can do, okay?
Okay.
Just basically summarizing what we said. So a patient comes to you with a pulmonary embolism signs and symptoms, comes to the emergency room. So there is mnemonics. You can check the video number one. We discussed these mnemonics, but I'll just go on overview over them right now. Like there is this, you can use them or you can't. It's not important. There is something ER mnemonics called police BS. Okay, and the admission mnemonic is called V panic. We'll talk about. So
Mm-hmm.
police BS. This is what I mean. P pulse ox. O oxygen. L intubation if you need it, not all the time. Use your brain with the mnemonics. I IV
Mm-hmm.
access IV fluid. C cardiac monitor. I used these mnemonic honestly in the exam and it was helpful because at the time of the exam you have a lot of stress and stuff. So these mnemonic always something to fall into. Like you let you
Mm-hmm.
write them down while you think. EKG, okay, or ESR, okay. B blood pressure monitoring, okay. So you do that IV excess oxygen, and then you do physical exam after you did all of that. ER
Mm-hmm.
urgent. So you do police BS and then physical exam. You got the mnemonic police BS?
No, let me write it down. Just a second.
Okay. I'll give it
Okay.
I'll give it to you. There is like the video number one, I'll give it to you. It has
Okay,
so
thank
you
you.
will have
Okay.
everything.
Okay, go ahead.
Okay. After that you do this is their mnemonic is that for general labs just in case you forget everything you have something it's called cut gleam that's what I do. C for CBC CMP, U for UA. You don't have to do all of them. I'm just gonna go off. T
Mm-hmm.
TSH. G for blood sugar. L for lipid and liver function test. E EKG. The second E for ESR and M for magnesium sulfate. Okay. So here
Mm-hmm.
you do CBC, you add to a chest X-ray because this is a different case. So you use
Yeah,
your
sure.
yeah, you can use your brain with the mnemonics. This is just to help. No. C, you
Mm-hmm.
can do cardiac enzyme. D dimer. ABG, this is important. After you find hypoxemia, you find that. And
Mm-hmm.
pulse oximetry, you time every 2 hours. After that, you advance the clock to get the test results. Okay?
Mm-hmm. Okay.
And then, once you note an elevated D dimer with a low oxygen and respiratory alkalosis on ABG with normal chest x ray, this is a high suspicion for PE. So, what do you do
Yeah.
after that?
So I believe you should start the treatment as soon as possible.
Okay, what do you start?
So we said that he's unstable, right?
No, like right now, he's stable, but so this is yeah. So he's stable. This is what you do. You correct. You try treatment immediately. So, but you
Mm-hmm.
start before you start the anticoagulation. You want to do a PTT and you time it every 6 hours.
Uh-huh.
You want to do CMP
Yes.
and you want to do spiral chest CT. You put that, and with that you put the heparin. Okay,
Yes.
IV and continuous. Okay, but so only if you think that there is a renal failure. If there is no renal failure, you can start low molecular weight heparin. Okay,
Mm-hmm.
if there's normal creatinine level, depend if you get the renal function before like quickly. So it depend. You can start low molecular weight heparin. After that, what do you do?
After you will we're gonna monitor the INR.
Yeah, yeah, it's like that.
Okay.
You advance the clock to get the CT scan.
Ah,
Okay, yeah.
yes.
After that, you get the CT scan. After that, once you confirm DVT, you are in the emergency room now. What do you do?
Okay, so yeah, and at that time when we confirm it with the CT scan, now I believe it's the time to check because you already gave the heparin, you were gonna check the INR, and you were gonna check the BT,
So,
BTT.
but
So
he's in the emergency room. Do you think that we need to place him somewhere else?
yeah, you were gonna move the patient.
Admit. So this is important. You
Yeah,
gotta admit him, and the INR do it because the DVT case that we did, it was like an outpatient, so we brought him back. But this one in a
yeah,
hospital,
yeah,
we don't want to keep him in the
yeah.
emergency room. So we admit. Once we admit, what does that mean? We mean we panic. So the mnemonics called V panic. V panic is
Mhm,
that just to keep it in mind. You don't have to do it all of
mhm.
it. But V for vitals, you do that every 4 hours. P, this is for PPI IV. This is for peptic ulcer. You don't do it for every case, or stress, Cushing syndrome, or Cushing, like increase intracranial
Also,
hypertension. Yeah,
yeah.
Cushing ulcer. Yeah. A for activity. You tell him if it's bed rest, if it's like what is it. Okay. And for null per mouth, if there is diverticulitis or something. I for IV excess IV fluid, if you haven't done it in the emergency room. C, let me remember. See, compression stocking.
CBC.
Compression stocking, I think. Yeah,
Compression.
yeah,
Okay.
you can do that.
Okay.
Okay, so you do this complete bed rest, regular diet, INR daily. This is easy. You just put INR Q day. That's it. You're done. CBC Q day. That's it. With the software, will take care of it. So you don't have to do it all the time.
Hmm.
After you admit, what do you give? You give oral warfarin because you don't want to keep him on heparin. Okay, so
Yeah, sure.
you start on warfarin. After that, you request interval history and you follow up like every 8 hours until you get the therapeutic INR 2 to 3,
Yeah.
and the patient improves. After the patient improves, what do you do?
So when the patients improve, I believe that the case we're gonna stop here, right? In
Yeah.
the
So
CCS.
when the case stops, what do? You do two things. It's called cancel and counsel. Cancel oxygen pulse ox cardiac monitor BP monitor if improved, and counsel if he's smoker, medication appliance,
Mm,
medication adherence, screening. Okay, these types of things. Okay, so it's simple.
okay, that's nice.
Okay, remember cancel and counsel.
Counsel, yeah.
So just quick recap for the case. So how do you do quick recap? So you do when in the in emergency room, you do police BS. After that, you do the cut gleam with the
mhm,
PT, and then you start medication. And then once you do CT scan, and then you get the CT scan. Once you get the CT scan, you confirm it. You do V panic, okay, and then you start
mhm,
warfarin, and that's it. So if you look at the CCS cases, it's very interesting. A lot of the things are the same. There's two or three things that are specific for each case, and that's what our course about. It's about looking at what test that we ordered for each case. For example, this case, we did the police BS, okay, the same thing, we
mhm,
did not change it, okay. And then the cut gleam, we did it, the additional step, cardiac enzyme, ABG chest x-ray, okay, these are the
mhm,
additional steps. And PTT, that was additional. Spiral CT scan, that was additional. And Lovenox, that's additional. And then when we admit, V panic is the same for every case. The additional stuff is the INR daily, CBC daily, and we are for in oral. That's it. It's very simple, you know. So if you summarize this case, if you know the mnemonics, all what you need to remember the PTT, Lovenox, spiral CT, warfarin, and that's it.
yeah,
Okay, it's very easy. CCS cases,
yeah, you make
yeah,
it easy. Yeah, thank you so much. Yeah,
are very simple. Okay, so we're gonna do quick rundown on the mnemonics so that you remember them. Police, BS, P, pulse ox, O, oxygen, L, intubation if needed, I, IV excess, IV fluid, C for compression, cardiac monitor, E for EKG, B for blood pressure monitor, okay, S for blood sugar like finger stick glucose for hypoglycemia, okay. And again, use your brain with the mnemonics. You don't have to do all of them, but it's something
yeah,
just to keep in mind. I found it very helpful for me when I was studying. And then you do the cut gleam, C for CBC CMP chest x-ray, U for UA, T for TSH, G for glucose, L for lipid panel or liver function if there is no CMB in their exam. Okay, so liver
mhm,
function. E for ESR, the other E EKG, the M for magnesium phosphate. That's how I remember it. Okay. After that, you do the PTT, spiral CT, heparin,
yeah,
and then once you
boo.
admit, you panic. V panic. V vitals. P PPI, if needed in Cushing ulcer. A for activity. You gotta say the activity. Bed rest. What is it? Diet.
Yeah,
Remember that. Okay. A activity bed rest. You can do it. N for null per mouth if needed. I for IV excess IV fluid. Okay. If you haven't done
mhm,
it. The I here with police ES is IV excess IV fluid. So if you've
yeah,
done it here, you don't have to do it here. But it's in the mnemonic to remember. C for compression stocking. Okay. So this is the pulmonary embolism CCS case. I hope you
yeah.
find this helpful. Thank you so
It's
much
really
for
helpful.
listening, and we'll see you on the next case.
Thank you so much.
You're welcome.